So, ladies and gentlemen, dear colleagues, welcome to this press conference to go over the situation of COVID-19 in Quebec. The Premier of Quebec, Mr. François Legault, and as usual, together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Thank you very much. Hello, everyone. I will start right away with the numbers of the last day. We have 75 new deaths, so a total of 435 since the beginning. I, of course, wish to offer my condolences to all families and loved ones of these victims. We have now 14,248 confirmed cases, an increase of 691. We have 936 people hospitalized, an increase of 57, and 230 people in ICU, an increase of 4. Of course, our great priority remains the situation in CHSLDs. First, and this is not much of a consolation, but when we look at the situation in Ontario, New York, and in France, pretty much everywhere in the world, we have the same situation in housing centers for long-term care. There are people who are older and people who are ill. So these are, in fact, the people who are the most vulnerable. However, and I've said it and I continue repeating it, we already had a staffing problem before the crisis started in CHSLDs. We had a problem attracting staff. In the budgets that we've created, amongst them the past year, we had increased the budgets for CHSLDs, but unfortunately, we still did not manage to fill the positions that were posted. The situation deteriorated a great deal in the past few weeks. We have today 1,250 employees just in CHSLDs who are absent, either because they've been infected or because they fear getting infected or any other reason. But we still, on top of everything else, we have 1,250 employees missing. I want to start right away, perhaps with my daily thanks. If you weren't aware of this story, which was written by Patrick Lagacé in La Presse, you know that when there's drama, there's always also people who stand out for exceptional human reasons. And it is quite a story in the drama of the CHSLD Heron in Dorval to see that Dr. Larente, who arrived on that infamous evening where most of the employees had left the CHSLD, she called her husband and her 3 children, 13, 15, and 17 years of age, to come and help her out, to be able to give meals to the 130 residents who were alone. Of course, these kinds of situations that are unimaginable in 2020 in Quebec. But what bravery, what admirable sense of humanity on the part of Dr. Larente, her children, her husband. Of course, in the name of all Quebecers, I want to thank her. And the reason why I wanted to start by speaking of Dr. Larente is because I would like to make a call to everyone. In CHSLDs, I've just said so, we don't have enough medical staff. We are transferring staff who were in hospitals and we are sending them towards CHSLDs. All kinds of staff. And I'd like to come back to one thing that I said yesterday. I said even specialists have general training in health before studying in a specialization and can come and fill positions, for example, of somebody who works as an orderly. They are able to do that. But in saying so, I didn't want to insult general practitioners and family doctors. Some said that they were shocked because they said, well, we too, just like specialists, we have additional training as family doctors. The message that I wanted to send out quite simply is that we need people. We need people with all sorts of different training in the medical field, whether they be doctors, family doctors, specialists, nurses. We have to fill this lack, this shortage of orderlies and attendants in CHSLDs. And we need everyone. So I am calling out to everyone. We have had people since the beginning of the crisis who had retired or who had left the health domain but who have skills and abilities. And I'm asking you, we need you in CHSLDs. So you've also seen that we called out to all teachers who teach in nursing sciences or in medical care, whether it be in professional training centers or CJEPs. It's not a question of decree. We're not wanting to force anyone, but we're talking of over 2,000 people who teach and have those skills in the health sector. So I would ask you, to all teachers, all professors in nursing care, we need you in CHSLDs. We're also going over social economy organizations and companies. Some give care to patients, whether it be at home, at people's homes or others. And once again, we are making a call out to everyone to come and work in CHSLDs. What we also concluded, and later Dr. Arruda will be speaking about it, we agreed on a way of working so that certain caregivers, like family members, be able to come to certain CHSLDs. We want them to be people who have a certain level of experience, who've done it before, also people who are known by the establishments. Of course, we will be taking all sorts of precautions. Having a negative test, having the medical equipment, not being close to the other patients or the employees, but caring only for the one person that they know. And when they go home, of course, being careful with continuing to keep the 2 meters from other people in order to not get infected. So yesterday I was talking about the balance of inconveniences. That is what we've been weighing. And we believe that taking into account the lack of staff in CHSLDs, it may be worth asking certain caregivers to come and give us a hand. But I want to be clear. If you're not a caregiver identified by the responsible people in the establishments, the ban on visits remains. I get it. I know that a lot of people would like to see their parents and visit them. But I don't want that we have to repeatedly ask management of CHSLDs to absolutely come and visit one's father or mother. Here we're talking just of those people who will have been identified by those responsible for the establishments to limit the number in order to avoid the spread of the virus. I had asked the people responsible of those establishments and facilities to have one person responsible for calling families. I'm told that it's working well. I'm told that 95% of facilities have called family members, so there's a 5% left. And we are going to continue on that side. I think it's important. Since there are no visits except for the identified caregivers to be able to give news to the families. We also decide that as of today, in order to be transparent, we're going to be giving you a list of all the residences that are under quotations, under surveillance. And I would like to tell you, moreover, that we've finished with the visits at the 2,600 residences. And I just want to tell you, because I know that certain people asked for inspection reports. We're not creating paperwork here. What we wanted is to visually see where there were problems, to see which are the residences that we have to keep an eye on or help out. The idea is not to create paperwork. It's to give ourselves a list. And out of the 2,600, there's 41 residences today, as of today, that are more critical, more places where we wish to follow the situation closely. Of course, that will change from one day to the next. We will be republishing that list every day. So let's be prudent with the use of this list, because the list that was good last night perhaps won't be good tonight. There are some residences that will be added, other ones that will be removed from the list. So I would like to end by saying I understand that the present situation is difficult in CHSLDs. Perhaps we did not expect so many infected people. This virus strikes hard, and we've seen that in certain cases, staff that didn't even have symptoms probably did infect residents. And so it has to be understood that, unfortunately, we will not manage to save everybody. But the big problem is really in CHSLDs. When we look at the situation in hospitals, it must be said that it's really not as bad as we had thought. So we do have better days ahead of us, and we are more convinced than ever that we are reaching that peak. But the peak, it does say it, it's a moment when the situation is at its worst before it becomes it starts improving. So I wish to once again call out to everyone. We need experienced staff who have skills in health in our CHSLDs. Yes, we filled a good part of those positions, but every day there are, unfortunately, additional staff that don't go to work and needs that are amplifying with the number of people that are infected by COVID-19. So I would like to say to everyone, we're doing everything to protect our elderly, to care for them with dignity. But we need the help of those who can come help us out in CHSLDs.
Before I let Dr. Arruda talking more about the rules that will be put in place. Good afternoon. As I said since few days now, our top priority remains the situation in our senior residences. We are deploying more professionals from the hospitals to the residences, but we're still lacking staff. I'm asking everybody available, every health worker, to come forward and help us. I appeal to your sense of duty to help us protect the most vulnerable. We need you. We will also experience caregivers to help their loved ones. But apart from these identified caregivers, visits will remain forbidden for the other ones. I also want to make sure families of the residents are kept informed. That's why I ask that there be at least one person in each residence in charge of communicating with the families. We will also start today publishing a list of residences where the situation is under surveillance. I know the situation is tough for everyone, but it will get better. It's very important to continue our efforts. That's how we'll save hundreds of lives. Thank you all.
Merci, Monsieur le Premier Ministre.
Thank you, Mr. Premier. I would hand over the mic to Dr. Arruda. Very well. Hello, everyone. Since the beginning, all of our actions have one target, and that is protecting the health of the population, and particularly those vulnerable amongst us, people over 70. We knew right off the bat that it would be impossible here, as elsewhere in the world, to avoid all cases, and unfortunately, that population that is very fragile is hit by the virus. We also wanted to maintain our capacity to treat cases, that is to say, to flatten the curve and to not end up in a situation like they have in other countries where we would have had to choose between certain people in order to have access to intensive care. And that worked. The curve was flattened thanks to the work that you did together with us, thanks to the fact that you respected the guidelines. And you know, for public health, limiting the freedom of people, we have to have good reasons. And here it was to save lives, and I am convinced that we saved many, and that we did not have to make difficult choices like they had to elsewhere in the world. As measures, we banned visits in CHSLDs and in residences for the elderly. We banned visits, and it worked. The situation would have been much worse had we not done so. Our hospitals would be full to the brim right now with a lot of people that would be in hospitals and in ICU. But it has to be understood that, for example, with the knowledge that is improving, we realize today things that we didn't know at the beginning of the epidemic, that some people were asymptomatic and could contaminate people around themselves. And that is probably what happened with people who were coming back from traveling or who caught it elsewhere and who went into CHSLDs, where there is an important concentration of very vulnerable people. And it brought about the deaths that we are seeing right now, which disturb all of us, of course, and which are a phenomenon that we have observed elsewhere in other provinces and other places where there is a concentration of elderly people. A lot of people write to us, I get a lot of personal emails, to change the guidelines. Today, I would like to ask the collaboration of everyone to respect to the letter what we'll be doing in CHSLDs. The Premier already talked about a few elements of it, but I have to tell you, it is very important that you understand that you must respect what we're telling you right now. This is only for CHSLDs, where the most vulnerable people need much more concentrated care in terms of hours than what is to be found in other residences for the elderly. And this will be done for these patients and their close caregivers. It has to be understood that these are people who were known before the pandemic. These were people who went regularly before the pandemic to offer either food or helping drink or basic hygiene. There's about 10% of people in CHSLDs that have that kind of natural caregiver. It is sad. I know it's going to be difficult for the children who used to go see their parents over the weekend because they worked, etc., and they didn't have the ability to become that caregiver. But I want to tell you that we can't open up the door intensely in the present context. This is a voluntary measure, and I want to reiterate here, we're not forcing anybody who used to do it to come back and offer care. It is one person for one patient. Those people used to come before the crisis, and as I said it, they offered certain kinds of care. It's not for families and visitors. I understand that it's difficult, but it's not the time. These people will be identified by the management of each facility. They are the ones who know who came before, and they will have to meet certain criteria and sign an agreement so that they know what they are exposing themselves when they go to that place. And they will have notes. There will be notes for the establishments, for the patients, for the caregivers to know what to do in what situation. And if ever anybody develops symptoms, we'll tell them exactly what to do. This measure will start Thursday morning to allow us to better prepare all instruments, the material, that will be necessary. You know, the people in CHSLDs, managers, are very solicited to offer better quality care, the best quality that they can. If you are a person who is not in that category, I would ask you to not put extra pressure or to complain against the choices that will be made by those facilities. They are not the ones who are making these rules. We are. And I have to tell you that we have to go step by step, because if it becomes chaos, we'll have to take a step back and we'll all lose out. So please, I beg you to be patient. And I know it's difficult, but please respect the guidelines that we will be giving. But we will allow certain people who are former caregivers with people in situation of great vulnerability to have that contact again. The more we respect this, the more we'll get out of everything quickly, and the more we'll be able to broaden the approaches, and the more we'll be able to come back to normal. I thank you, and I ask you, especially to those who are not meant to be affected by this measure, because it will be the majority of people, to please respect it, even if you find it difficult, what we're asking you again. Thank you. Question period will start today with Patrice Bergeron. Hello, Mr. Premier, I quote you, last week in the press conference you said that you were meeting the health teams every morning, and I ask my team, is the head of the facility competent? Does that mean that there were incompetent ones? And what do you do if somebody answers you that they're not competent? Well, we help them out. That's what we're looking, and that's what the objective is. It's to look and see whether the situation is managed correctly. Are there hot zones and cold zones? Does the staff know exactly how to use the equipment, etc., etc.? So I don't know if you're referring, for example, to the Heron CHSLD, but we knew that there was a problem with management there, but we didn't know the scope of the problem. I'm telling you today that there's 41 residences that we're keeping an eye on very closely, where there are a lot of cases, amongst other things. So that is the role of those who are responsible of those facilities to make sure. And we went to do even further. There are people who went to visit physically each of those 2,600 residences, so they had the time to meet with management, to ask a few questions, and to see who has the situation well under control and who doesn't. I have a question of a colleague who says, we know that you're worried by the economic recovery. Are you going to review the migration thresholds downward if it's slower than predicted? We're not there. But in fact, it is something that we'll be studying. We have to review everything, and amongst that, the number of immigrants. With the high rate of unemployment that we're going to have in the next few months, we might, yes, reduce that number.
Bonjour. In
the people that you want to bring back to CHSLDs, you talked about 1,200 people who are absent. Does that mean that you need 1,200 people, or you need more? Or, well, as I was saying, first, we were missing people before. However, now, temporarily, we've taken people from the hospitals to bring them to CHSLDs, so we have filled a good part of our need there, but those people are going to have to eventually go back to the hospital, because we're going to have to start back with, for example, operations that were delayed. A great hope that we have, it's 2,600 teachers who know healthcare and who could come and work in CHSLDs. I mean, that would be extraordinary. We have adopted a decree to be able to do so. Those people are already paid. Our teachers are still being paid, and they will have the right to that premium that is given in CHSLDs. So I'm calling out to their sense of duty more than anything. We need them right now. You're talking about professors. That brings me to the next question. Back to school. I know that the date isn't determined, but will professors be forced to go back to teach, because some of them are perhaps 60 and over, others are perhaps affected by more fragile health conditions. So will that be mandatory? Well, we're not there yet. I said so before we asked teachers and professors to go back to school, and we asked children to go back to school. We're going to have discussion with Dr. Arruda to see what measures we had to set up. Will it be full classes? Will it be in all regions? What are we going to do with those teachers who are over 60? That's the kind of question where we'll have guidelines. But I want to be quite clear. We're not there yet. There's no question of reopening schools in the short term. My question is for Ms. McCann. You said that you are looking for people, that there's staff missing in CHSLDs. I'm told that the hygienists and I think it's 5,500 members, apparently they proposed to you, the dental hygienists, the services of these people, certain people who have skills and expertise in hygiene, and that there was no follow-up given to those people. But could dental hygienists who do have training in hygiene, as well as dentists themselves, who are also people who are from the medical domain, I understand that they have a very specific specialization, but they do have medical training in pharmacology as well. Are these people who are taken into consideration by your ministry to come help out in the network? Well, listen, we're going to be looking at that quickly because you're right. These are people who do have training, basic training that is very interesting. So I am taking good note of it. And I would like to add that any professional order that considers that they could give us a hand, we are open to that. So we are going to do a follow-up very quickly. Because as the Premier says, we need everyone. And I would like to add as well that we have people who work in social economy enterprises who take care of people at home a lot, but some are available right now so that they can help us in CHSLDs. These are people with a lot of experience who can give a lot of basic care. So thank you. And if you have any other suggestions, our follow-ups are done very quickly in the present context. Mr. Arruda, when you made the projections last week, well, not you, you weren't there, but Dr. Massé, thank you. We were talking about a peak in the pandemic that would be around the 18th of April. Is that date in your projections, the way that it's going right now? Is that still a plausible date, or do you think it will be earlier or later? Have you adjusted yourself to that? If we're talking about the peak in the number of cases, because there's a difference between the peak in the number of cases versus a peak in hospitalizations and a peak in deaths, because they're not at the same time. You know, you catch the disease, but you don't die right away of it. So I think that the projections are about the peak of cases are adequate, perhaps even potentially earlier. That means that we right now are observing, and we have to make the difference between different regions, and we have to have the stability of data as well, because despite the fact that we announce to you cases every day, sometimes it's cases from the previous evening that weren't in the system right away. You know, it is complicated from the hospital to public health, and then there from that to the system and investigations, because of course we try to get statistics as quickly as possible, but our priority is to give care. So I think that probably we are in the peak and starting to go down, but this is going to be slow. This is not going to, you know, like since we flattened the curve, we flattened it in both ways. So in fact, you know, we flattened it. It's probably going to go down very slowly as such. And then we're going to have to remeasure the effect of all that. But I believe very important message. Even once at the peak, even once we start going down, we still have to be careful. Don't think that because we got to the peak, we can let go and we open the doors wide open. We're going to do like all the other countries in the world have done, a step-by-step, progressive approach, measuring the effects of our opening in certain areas, etc. We'll continue investigating cases and contacts. We're going to have even higher monitoring than at the beginning. You talked these past few weeks of protective medical equipment. Every day we knew which was close to shortage. In CHSLDs, whether they be private or public, at one point in the past few weeks, was there a lack, a shortage of this material? Not in the last week, no. And I would say even the last weeks. At the beginning, maybe there might have been certain CHSLDs, private ones that didn't have all the material, but in total, we've never lacked for material. Maybe some people didn't ask for it, but even if we were tight at some point, there was always enough to cover all CHSLDs, all hospitals. For when we start the parliamentary work, we've seen the leaders of the other parties talk to you yesterday asking for virtual meetings to be organized with ministers and members of the opposition. Yesterday we understood that you weren't interested by this proposal. What will happen beyond the 21st of April about this? No, I had a discussion yesterday, as I have every Monday and every Thursday, with all three heads of the opposition, and we talk about how we could do it after the 21st of April. Of course, it also depends on the people who would be questioned. I think that I don't need to explain that Danielle McCann perhaps has less time to give to that in the next few weeks. But I understand at the same time, particularly with the situation in CHSLDs, that the opposition leaders have questions to ask. So we are finding a solution, and I have good hope that we're find an agreement.
Oui, bonjour à tous. Première question pour Dr. Arruda. La semaine dernière,
Dr. Arruda, last week my colleague asked you whether the elderly who are suspected of being infected by COVID-19 were tested systematically, and your answer was it happened. And we also have information from the field that allow us to believe that it is not done systematically, which makes us think that the death toll must be under-evaluated. So my question is, do you think that the death toll by COVID-19 in Quebec is underestimated, and why is it not systematically tested? Well, there's different reasons, and first I want to say, and I'm checking the definitions of cases in other provinces, but just to give you a comparative example, when you talk about heat wave in Quebec and we count the deaths, very often we don't wait for the investigation of the coroner at the end to know if it's the main cause. For reasons of intervention and surveillance, we count those cases. So we have cases, significant cases in Quebec and Ontario that don't have very many because they wait for the confirmation by the coroner. It's true that it's possible that we didn't test all the cases, but we have a case definition that involves what we call a case with an epidemiological link. So if you're in a CHSLD on a floor where there is one or two cases that were confirmed by lab tests, and in a room the next room over, you have one case. There's no other cause of death as such. We're almost sure. I mean, at a very high percentage that it's COVID-19. So that will be an untested COVID-19, not confirmed by lab, but considered as being a case. So those cases we have. And you will see that we have more and more because, and we often do it in investigation, we don't test everyone. We know that the disease is circulating right now. We're not in flu season anymore. So the possibility that it is a higher case is true, and then it's not a lab test. Is it possible now that people died of COVID-19 and for whatever reason they weren't taken into account? That's true. All systems have always underestimated deaths. In Italy, they think that they may have been 3 times more cases than what were reported. But it's also normal. So I would tell you that compared to other provinces, in terms of the quantity of tests that we have, there are probably tests. I mean, it would almost be impossible to think that we didn't drop the ball on a few cases, but not in a significant way. Also, in the context that we count cases that are associated but not confirmed by lab. And there's also cases where in postmortem we can't find, the sample wasn't adequate or whatever the reasons. And I could also add, as former Minister of Health, Quebec has always had the reputation of being more meticulous than other states in the world. This is true for when there were deaths, certain summers because of scorching heat, where we're wondering why we had more deaths in Quebec than elsewhere. Well, maybe elsewhere it wasn't declared. And I remember the question on the number of suicides in Quebec. Why did we have more suicides here? We realized it was because we did a more meticulous follow-up than elsewhere. So Quebec has always had that reputation, or as we say in French, Quebec, of being more Catholic than the Pope. So I'm not too worried about that. We may have dropped the ball in a couple, but I would be curious to know how many balls were dropped elsewhere. You are going to be publishing the list of CHSLDs that are critical, but we realize that the list published by media has an error. Don't you fear that other errors may end up in the list that you're going to put online and that we create worries, undue worries in the parents, for example, of the patients? And also, will it be possible to take a residence out of a residence affected by COVID-19 if we see the name on the list? Okay, well, two things. First, I asked the question on the subject of how many deaths in the Montreal Geriatric Center. It has to be understood that there's a certain delay in order to be able to analyze whether the person really died of COVID-19. Sometimes it can take a certain number of days before it be added. That is why, unfortunately, we know a little bit that, for example, in the death toll that we said today, there's probably going to be some that will be added that died in the last few days, but where we're still analyzing to know whether they really did die of COVID-19. So in the case that you're mentioning, that's exactly what happened. It's that it wasn't that we forgot to declare some. It's just because the number that is given and that was in the report is always the correct number out of the confirmed cases, but more are coming. I was referring to another residence that was not on the list.
Bonjour, Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Madame McCann, ma question va s'adresser à vous.
Ms. McCann, concerning these specialists, you launched a call many days ago, but it would seem that nobody has had a call for transfers to CHSLDs yet. What explains that delay? Is the machine too heavy? Why aren't people already there? Well, I will tell you, even right now, there is a telephone conversation between the Deputy Minister and the two associations, or federations, should I say, the medical federations. And I think that we agree with the General Practitioner Federation, for example, on a part of the telephone answer in terms of CHSLDs, RPAs, RIs, RTFs, and even, home care, which is good. But we also want for doctors to go on the premises and help out in CHSLDs, especially in CHSLDs, but also in RPAs and RIs and RTFs. So that is what is being talked about right now. Because, as you can see, we need everybody. For specialists, the discussion will be held about this as well. What can these doctors do? Taking into account that they are doctors, like any doctor, and that they can do things, certainly, in the context of the housing residents. So they offered to call the families, for example. Yes, but there's other people that can do that right now. So we're getting organized. I believe that there's a role for specialists in complementarity or together, I would say, with family doctors. So that is exactly what is happening right now. And we really wish for things to go forward quickly. If you will allow me, Ms. McCann and Mr. Premier, I'd like to come back to the question of the data, but I think it's an important question, if you'll allow me. I would like to say you cannot imagine the effort that is being put right now by the people who are in intervention to collect that information. It doesn't come from one just file where there's all the information that's already computerized. No, we have sources that come either through inquiries, telephone calls that we make, and there's also sources that come through seizures from declarations that and statements that doctors have made. So that's a lot of energy, and statistics are very important. If you knew, I mean, all the questions that you want, if we could answer you, from in 1 second, we would. But when we take the data, at 6 o'clock at night, during the night, a lot of things happen. Public health, through transparency, are going to give you numbers that end up being different. And when we're transparent at the speed where things move, you can understand that errors, even accountants can make errors sometimes when they correct. Or even predictions and things like that. I don't know if you understand. You cannot imagine. When we have a computerized system, a digitized system, but, we're developing it as the plane is flying. So there's going to be errors. We're trying to minimize them, but sometimes there's going to be a delay. So when we get up in the morning and we read your newspapers that you have this many deaths in that center because the information was given, but those cases, some took place after, etc., well, the numbers don't, pan out. And that's very disturbing when we try to create that. So I just want you to understand that if we don't make it transparent and we don't give them, people are worried because they don't know. If we put it and it's an error, it brings about a certain stress for certain people, but it will be corrected as quickly as possible. So I just wanted you to understand that, because otherwise we're going to have debates on numbers every single day. And the further we go, the more there's going to be cases, the more there's going to be a load on the system. And I can tell you that even in the world, even the World Health Organization didn't update all its data every day. And sometimes it's with countries that contributed, others who didn't, to the update. So I would also like to add something on specialists, because it has to be said that there are interesting things going on in the hospital setting. For example, an orthopedist that helps a colleague who's an internist. There's a lot of collaboration being done in hospital settings, and we know that specialist doctors would like to reopen their external clinics. We're not going to be able to do it completely. There might be a certain reopening. We are looking at things right now, but as far as surgeries are concerned, we can't really go forward too much because we still have a problem with the medication, but we're working on that. So what I was saying early on is that we want, for specialists, because there's a certain number of them right now that are not active, we want them to come and help us in these housing facilities. Ms. McCann, you spoke about something earlier on, and we've been talking about it for many days, the Heron residence. In the letter that you received on the part of the management of that on the 9th of April by that CHSLD, you were told that there were already 23 deaths and 27 employees who had tested positive to COVID-19. Did this news tell you the truth right from the beginning? Because the Premier said that you had learned it Friday, but this is dated the 9th of April, the letter where you were told that there were 23 deaths. Well, Friday was the 10th, if I'm not mistaken. So I saw the letter later, because a letter that is sent to me doesn't instantaneously arrive between my hands, It arrives at an address, Ministry for Health, and we, get it, but I don't get it within the hour. So I did get the information on the Friday evening, and Saturday morning it was all confirmed, where there were about 30 deaths in the past month. That is when I got the information. I would like to go back to the question concerning the University Institute of Geriatrics in Montreal, because I understand that they can be delayed, but we learned that there are 33 people who died, whereas the CEUS numbers on the same day talked of 5 deaths. So there is a very important gap between the two numbers, and I imagine that it's not all people who died in the hours preceding the update of those numbers. I would like to make sure that I understand what explains that important gap. And also, Mr. Premier, you were talking to us about the difference between the reported cases, the suspected cases. Is that to say that in many other establishments, the numbers would be much higher if we take it into account the suspected cases? Because that seems to be what is explaining the gap. Well, we're talking about two things here. The deaths, and I asked the question this morning, and I am told that the gap is explained by the fact that the deaths haven't all been analyzed in the moment that the report is generated. As far as the confirmed cases or suspected cases are concerned, well, that is a difference. Confirmed means that there was a positive test. Suspected, well, maybe the person has symptoms. I'm not sure if it answers your question. So are we underestimating? Because if I understand correctly, well, I think that right now in CHSLDs, there are more cases than in the number of confirmed reported cases. There's work being done right now to be able to do tests, and there are people who are suspected of being infected who are in part going to become confirmed. But I was talking more about the deaths. No, I don't think so. I think that the COVID-19 deaths are reported. It can take a few days sometimes before it is reported, but they're not underestimated, the deaths. Deaths are deaths. Hello, my question is for Mr. Legault and Ms. McCann. I would like to know, what do you think of the management of the CIS and CIUS when it, as related to CHSLDs? Are there things that you want to change? Well, listen, it's been a while that we've been talking about CHSLDs, and that we've been saying that there's a shortage of staff, that there are positions that are filled that remain unfilled. In private CHSLDs, perhaps the ratios should be increased. These are discussions that have been taking place for many years. Of course, there was a staff shortage in CHSLDs. We were aware of the problem, and that is why in the center of bargaining with the unions, we've always said that we need an increase in percentage that is higher for orderlies than for other employee groups. However, as I was saying, it's not necessarily an easy thing to do, to bargain with unions. You know, wage increases are not the same for all the employee groups. However, pretty quickly, we put premiums. For example, in the private CHSLDs, we emitted a $4 an hour premium, which is, you know, something for somebody who makes 13, that the government gives them $4 extra an hour. So there are premiums that were given temporarily. Are there 2, 3, or maybe 2 or 3, 5 years ago, we should have thought about having permanent premiums? Maybe so. Today, we're thinking that those people have an important work to do, and when we go through a crisis like we're experiencing right now, we have to look at that, because I realized that when we increased the CHSLD budget since we arrived in the government, well, unfortunately, we couldn't spend all the money that was put in CHSLDs because there were a lot of positions that were posted but unfilled. So there is a problem attracting people. There's a problem with the wages. But more than that, there's a problem that there's not enough attendants and orderlies that are trained in Quebec. So in the future, this is going to have to be a profession that people put more value on, not just for the wages, but generally speaking, because we can see today to what extent, more than ever, orderlies are important. I'm not saying that we didn't know before. The evidence of that is that we've been saying, you know, since we became government, that we have to increase the wages of orderlies. At the beginning of the press conference, you recognized that there probably was asymptomatic transmission of the coronavirus by SLDs. Taking this into account, do you still maintain the guideline of public health to call back employees who were in contact with people who were infected but who no longer have symptoms after 7 days? Well, listen, the issue of this whole thing is associated, I would say, to maintaining the services, because the person who would come back would be wearing, you know, a mask and be in a situation, and they know. So perhaps, you know, they would be even more prudent in that context. But as much as can be done, you'll understand that we don't want that anybody dies because we didn't give them care. You know, they won't die of COVID-19, but they'll die of something else. So these are situations that we're trying to do. These are exceptions, and that is why this guideline was set up. So very often as well, these people are going to sometimes work in environments where there's already COVID-19. So as I said, it's an exceptional situation, and well, we hope that it's an exceptional situation. And in the balance of risk, what we're looking at that is, you know, the 14 days is the maximum incubation period where we know that for most it will be less than that. But the staff that comes back with no symptoms and uses protective measures to avoid contaminating other people. That is why we need reinforcement so much. We have 6,000 workers right now who are absent from network for all sorts of reasons. And we want to also be able to give a break to the teams that are there on the premises. That's why we're making every possible effort. It's our priority right now to go get more staff. And just a point, the 6,000 people in the entire health network, of which 1,250 in CHSLDs that are absent. I just wanted to clear that up. That's all the time that we had for French questions. English now.
Today with from CBC News.
Hi, good afternoon. You repeated, Mr. Arruda, how many weeks you haven't seen your family. And Mr. Legault, you said many times, I haven't seen my two sons, and I cannot go to the birthday of one of my sons. How do you react about the fact that Prime Minister Justin Trudeau crossed the border this weekend to spend the long weekend with his family at his cottage, when you have such a reaction of Quebecers and of the citizens in social media saying, well, I mean, the success of these measures, restriction measures, are based on the discipline of Quebecers. What do you say to Quebecers today that say, well, if Prime Minister Justin Trudeau did that, I'll do the same thing?
Moi, j'ai pas de commentaire.
I have no comment.
And I think, I'm not following everybody here. There is probably other persons doing that kind of thing. I just hope that there are maintaining, I would say, some distancing aspects of this. But I think it's really the answer of the Prime Minister is the best one. Is you have no comment on this, and I would say it's not because somebody did something you must do it, and in fact try to respect the things. But so I cannot comment about the comportement of the Premier. Actually.
En français, c'est possible. Monsieur Legault d'abord, Monsieur Arruda.
Ben, j'ai pas de commentaire.
Well, I have no comment. The answer of the Premier is the correct one, but I would also like to say that people who don't necessarily respect guidelines, there might be others as well. So without commenting on that case in particular, I do hope that when they do that kind of thing, that they move around, that they do respect the guidelines of, not going if you have symptoms, you keep social distancing, etc. In applying certain measures. So, to go along with what we're telling people, to not transfer. And we also do it for, workers as well. So there is a situation to comment case by case. I can't comment on details, but the best answer is that of the premiers. That is, no comment.
Since last week, you've been announcing mitigation measures to help CHSLDs, for example, being really hit hard by the outbreak. Now yesterday you sent a message to people that would be interested to become orderlies. Today, anyone in the health system that would like to help, please come. What's the importance of your messages, Mr. Legault, about the severity of what's happening, the situation that you're asking people to come forward, but it's not an obligation, but they want them to get the message that the crisis is really high in CHSLDs.
Yeah, I think the crisis is important. We follow very closely 41 residences where there are many cases, and it's not easy to get all the personnel. And we can understand that some people from the staff are infected, and some are scared about getting infected. So we have a situation where you need courage to go there, but we need to get people. For example, the teachers teaching medical sciences, for example, in our colleges, we're asking them to come and help us. We're asking specialists, even if we won't use their science about their specialty, to come and help as a normal worker because we need them. We need all the staff possible. We need nurses. We need doctors. We need all the personnel having the expertise to help us in CHSLD because even before the crisis, the jobs that were posted weren't filled. On top of that, we have all the people that are not coming to work. So we really need to have some people with expertise in medical science to come and help us in CHSLD.
Thank you. Next question, Samuel Pouliot, CTV News.
Hi. Yesterday, while you were doing this press conference, we are hearing that there was only 2 employees for the entire Heron senior home. Do you know what's the situation right now? Is the care adequate, and are the families getting all the information they need?
But they told me that it's under control now, so they must have the right number of staff.
Okay. And the federal government says that the Canadian Armed Forces Medical Corps could be called to help in seniors' homes if the provinces need it. Did you get in contact with them?
Yeah, we're asking them how many people with the expertise in health care can be sent to us, but we're still in discussion with them.
Okay, so you're asking
Thank you.
help.
But we are asking about the number of people they have.
Thank you. So the next question has been sent by email it's a question from Raquel Fletcher, Global News. Can you give us more details on the plan to ask teachers to work in healthcare? Will they have the choice? What will they be doing? And what impact will that have on reopening schools?
But first, I'm asking them. I ask them for their help, so I would like that they come even if they are not forced to do so. So we need them. It's a question of duty. Now, as you can imagine, number of teachers teaching medical sciences are a limited number of teachers for all of the different sectors. So yes, we may cause a small problem eventually if we reopen these sectors, but I think right now the situation is urgent.
And I just want to say that the exercise being done by region, so the CIS or the CIS are being in contact with the school board or the college, and they're organizing the teams, and it could be nurses or teachers in nursing, but also different like social workers in social work, in occupational therapy, even administrative staff also.
Thank you. And as a second and very last question, what could the federal government do to better to protect residents of retirement and long-term care homes?
But like we said, we are asking them questions about the number of people with expertise in the army about medical sciences. So maybe that's a place where they can send us some workers, but I don't see anywhere else.
And I just received also a question from Phil Autier, Montreal Gazette. For Mr. Legault and Mr. McCann, on a daily basis, there are sad stories about seniors sick and dying in residence. What will the government do to better protect our seniors? The Parti Québécois says we need an ombudsman for seniors.
Well, I think the priority is right now to get more staff. That's going to be key to give the care and to relieve some of the staff that has been there since the beginning, and to take all the measures that has been recommended by different experts, but also to put them in place. That's what we're doing. They're already in place. We've talked about it to you, to have those zones, the hot zones and the cold zones, and that also, if we have more staff, we're going to be able to have people devoted to some units, and they won't go from one unit to another or from one establishment to another. And I want to say, this is really tragic. It's a human tragedy, what's happening right now. It's very difficult for the families, and it's very difficult for the staff. We're losing some people that are very dear to us, and we won't stop at anything to really, really protect them. We know that there are people that are very sick who are in long-term facilities and that are very fragile, so we will do everything we can to protect them.
And the second and last question is also for you, Madame McCann. We are hearing stories that the promised help for CHSLDs is not arriving fast enough. Madame Marguerite Blais was on the radio today asking for des bras. Why is the bureaucracy so slow to act?
Well, we're getting there because I think we've organized the incoming of people who come from the education sector. And as I mentioned before in French, we have les entreprises d'économie sociale. We have hundreds and hundreds of people that will come and help us. And this is in short term. So we're organizing very fast. We're doing everything in a very fast way in this crisis. And I think we're going to get those added people that will relieve the staff that is there right now.
So thank you all. It's all the time we have. Merci tout le monde et à demain.
Thank you, everyone. See you tomorrow.